Hello, I'm Maureen Holliker. I'm from the Children's Trust Fund Alliance, and welcome to the Strengthening Families Networking webinar that we have every month. Today's topic is parents' experiences at the front end of the child welfare system. We'll start off by letting you know just a little information about the webinars that we have every month. It is an open invitation to anyone across the country using the Protective Factors Framework and coordinating Strengthening Families efforts and beyond the country. We definitely have had folks join us from outside the country. Jointly convened by the Center for the Study of Social Policy. Kaylin's over there. Oh, and this is my alarm letting me know I should be here. Jointly convened by the Center of Social Policy and our Children's Trust Fund Alliance. Topics and guest speakers are coordinated by CSSP and the Alliance, but we're always welcome volunteers and suggestions. So let us know if you have a topic that you would like to talk about or hear. The recordings and the materials from past webinars can be found at this link, and I know Kaylin will put that in the chat box for you. And then, so the webinars happen every second Thursday of each month, 3 o'clock Eastern time. On April 13th, we plan to have childcare after the American Rescue Plan with CSSP's policy team. You'll see a link there to register, and Kaylin will put that in the chat box. May 11th and June 8th, the topics are yet to be announced. And if you would like to subscribe to CSSP's Strengthening Families newsletter, you will get all of the webinar invitations. And Kaylin will also put that in the chat box. So today's agenda, parents' experiences at the front end of the child welfare system. Today with us, we have Teresa Rafael, who is the Executive Director of the Children's Trust Fund Alliance. Tiffany Allen, who is a Research Director with Child Focus. Jennifer L. Brooks, who is a Senior Impact Advisor and President of Jennifer L. Brooks, LLC. Dee Bonnick, who is a National Parent Consultant and member and also of the Alliance National Alliance Birth Parent National Network, BPNN, and Meryl Levine, who is the National Director of Parent Partnerships with the Children's Trust Fund Alliance. After we have our presentation, we will have questions and answers and discussion. And then I will give a brief update from the Alliance, and Kaylin, I know, has a few updates from CSSP. So with no further ado, Teresa, I will hand it over to you.
Teresa, you're on mute.
I just saw that. Thank you. Thank you, Maureen, and welcome everyone. We have been really looking forward to this time with you all and the opportunity to share what we think is some critically important information. Unfortunately, all of it won't be new information to many of us, but it really will validate and verify what we know, and we have information in the parents' own words that we'll be able to learn from and share. It might seem a little odd to some folks that the Alliance with our work in prevention is also really focused on this initial aspect of child welfare investigations, and just wanted to share why we think it's so important that all of us pay attention to this. At the Alliance, we have a real focus on our members, children's trust funds, always a top priority, and the community-based prevention work and family strengthening work that they're doing and their partners and others around the country are doing. We have a big focus, as most of you know, on partnering with parents, and this, as you'll hear, this project was really set up as an amazing partnership among all of those involved. And then we got involved as a way of recruiting, supporting parents who would be part of the project. And the project became as things can do sometimes when it's the right thing at the right time, it became a much bigger project than we, at least at the Alliance, anticipated. And I'm delighted you'll hear all these details today, but just to say, we're in a phase now of sharing the information, and we want to continue to look together at what's the meaning of this as we think about our work with prevention, as we think about mandated reporting, and how do we shift some of that frame to support for parents, as so many parents get reported who don't need to be, and what can we as a prevention field do that will help support parents even earlier, before they ever come to the front door of the child welfare system. So with that brief intro, I'm going to turn it over to Tiffany Allen, who really managed us all very well and kept us going and was the project leader.
Thank you so much, Teresa. So I'm going to kick us off our presentation today. And this project was all about how to reimagine or rethink how child welfare investigations and case planning is done. And so I'll give you a little bit of background, and then we're going to talk about the process we use for the project and then go through some findings. This project was funded by Aviv Foundation, the Aviv Foundation, and the Stand Together Foundation to explore a part of the child welfare system that isn't often examined enough. And we're talking about the investigations in the early case planning process. So when I say case planning, it's just the service planning that's done with families to avoid deeper involvement with the child welfare system. There's been a lot of work focused on kind of the deep end of the system, foster care and adoption, and we're paying a lot more attention to prevention. But looking at the investigations process and if it's effective has largely been left alone. There's been some work around alternatives in addition to what we already have in place, but we haven't really thought about rethinking the whole process and what the possibilities are for doing it in a different way. Now, the process of investigating a family when there's an allegation of abuse or neglect, I realize that some of you all today are not from the child welfare field. So I have to say there's pretty much an assumption in the field that it's not working, or it's not working very well. So we based this project on that assumption, but we wanted to explore that more deeply. So this project explored whether there was a need for a new approach to investigations and case planning. And the true focus of this was to capture the parent experience, because that experience has largely been ignored in the child welfare field. And so we started with wanting to know the parent's experience, but then that expanded to capture other perspectives as well. So the overall project captured, we got data from 100 parent interviews, I want to make sure I say that right, 31 youth interviews, focus groups with parent attorneys, and then surveys with judges and investigative workers. Now, this project was intended to be different. So the whole intent was to have a participatory approach with very heavy engagement from birth parents in the design of the process. But it did take us some time to get there. At first, we weren't exactly fully engaging our parent partners, but through open communication as a group, we did form a bond where everyone could share power. We shared ideas, we made decisions together, even alongside the funders, right? And for most of us on the team, that had never happened before. Okay, so I'm going to share a little bit more about that. And before I go to the next slide, just want to share the key questions we wanted to examine. The real focus of this was, what is the purpose of a child welfare investigation? But through our engagement with the parent partners, we realized it's also important to document the experience from the perspective of those going through that process. So we did add questions about how does it feel? What is the impact on the parent, on the child, and on the family in general? What supports did they receive through this process? And then also in trying to assess the purpose of an investigation, we wanted to know if it was equitably serving its purpose, if there were differences in experiences across respondents. And we also asked respondents to provide suggestions for what a new approach, how that would look. So we can go to the next slide. So while there were multiple perspectives captured, so I just talked about us getting information from parents, from youth, from attorneys, judges, and workers. The bulk of this presentation, most of it will focus on the parent and youth experience. But I also want to talk about the parent interview process just a little bit, because that's where we kind of carried out the participatory approach. That process was the largest and most complex piece of this project. As I said before, our goal was to interview 100 parents from across the country, and it was really to get at their CPS investigation experience. For each of our interviews, there was a parent who was the interviewer. So a parent who had CPS experience actually interviewed 100 parents, and we had 10 total interviewers. To help make this work, we had a core team, which was developed to guide this whole process. Their role was to design the interviews, to help interpret findings, and to provide feedback on different project components. That core team included 5 parent partners from across the country who were part of the Birth Parent National Network, the Children's Trust Fund Alliance. We had Meryl, Teresa, and many of their staff folks there. We had representation from the Annie E. Casey Foundation and also the Stand Together Foundation for their experience in the child welfare system. We had Jennifer as our research consultant and her awesome assistant, Claire. And then also myself as the project manager and our funders, the 3 funders, participating in the core team as a part of the group. We met monthly, and sometimes even more than that. We used a circle process where at the start and finish of the meeting, we gave every single person a chance to respond and react. We also worked in subgroups together. So if we needed to work on detailed tasks, we all worked together within those subgroups. So a parent was involved in every aspect of it, in designing the interview questions, designing the recruitment and selection, and they were represented with every decision that was made on this project. So what you'll find as we share more is that the process that we use mattered just as much as the findings. And we don't want you to lose sight of that. We learned it's just as important how it feels to the people being involved as to what you get out of it. So the input that we got from our parent partners, the investment we made in making sure they were an equitable part of the process made our data that much richer. So we're going to spend time actually sharing what it was like to be a part of that core team through information from Meryl and Dee. And again, to make the case for why it's so important to center lived experience and share power when it comes to decision making, when it comes to research, and when it comes to reform. This next slide, I won't share much else. I'll just say that we were very intentional in making sure that we got a diverse representation of parents and youth. So we paid a lot of attention to race, gender, urbanicity, their experience with the system, whether they just had an investigation, whether there was an open case, or even a removal. And so that was really important for us to make sure we got that geographic representation. So just keep that in mind as we talk through the findings. So I will turn it over to Meryl.
So good afternoon, everyone. So nice to be here with all of you. And I'm going to share just a little bit more as Tiffany was saying about the process itself. For this particular project, the Alliance's role was initially to identify 5 strong parent leaders who would serve on the core team, with an additional 5 also serving as parent interviewers. We focused, as Tiffany was just saying, on ensuring that a diverse group based on gender, race, and geography, but we were also looking with parents that would have strong relationship building skills and the ability to work well within a team. For this group, the Alliance did a lot of work around providing training, compensation for their time, and extensive support. In terms of how it really felt to be a part of this project, some of the early core team meetings that we did do, they felt very hopeful, but also very tentative, because many of the parents on the core team really felt okay in terms of sharing their thinking, and they even questioned some of the initial concepts. We were really pleased throughout the project at the level of openness and the demonstrated respect for the diverse opinions that we really got from the team members. This helped us in building trust and really led us to an in-depth conversation around the important issues that needed to be discussed. Because of the topic and the past trauma of parents being interviewed, it was particularly important for us as a team to ensure that the parents on the core team had a strong voice in determining many of the elements and the design of the project. In all of our years, the Alliance has worked across the country in a lot of multiple settings, and in joining in partnership with parents and staff, we found that this particular project really stood out as one of the best examples of a true partnership. We felt a great responsibility to do no harm to the 100 parents who were being interviewed, and we really appreciated the clear commitment of the funders and the expert guidance of the researcher. Now, I wouldn't say that we didn't experience a few challenges, but thankfully we were able to address all of them. Some of the key challenges that we did address in the beginning stages were really identifying parents to fit that demographic criteria that we really needed. We also had a little bit of a challenge in terms of scheduling 100 sets of interviews. And with each interview, we were scheduling with the parent who was being interviewed, the parent interviewer, as well as a note taker. So that was a little bit of a challenge. We did encounter a few cancellations, and so we had to reschedule throughout that process, but it worked itself through. Because of the strong commitment of the core team to support the parents all throughout this project, we really built in some critical supports, and some of those supports included, we did an introductory video, and Dee, who's going to talk in a few minutes, was our key star in doing that particular video. We created a list of resources that we provided to the parent interviewees. We also did follow-up calls, and the interviewers actually sent written thank you notes back to the parent interviewees. All throughout this project, in addition to providing honorariums, there was a respectful tone throughout the entire interview itself. And there was an opportunity even for the parent interviewee to stop the interview at any time, and still they would be able to receive the honorarium. Overall, in terms of lessons learned, clear and open communication throughout every stage of the project really helped to ensure transparency, and it made it easier for all of us as partners to engage in this process. The momentum of the project stayed strong all throughout because we were able to work as equal partners in the process itself. And now I'd like to turn it over to Dee, who will share some of her perspectives in terms of working on the project as well.
Thank you, Meryl, and good afternoon, everyone. I've been doing this work as a parent leader for about 20 years. And so I've served in many capacities, been in many projects, and I would want to say about this particular investigation research participatory project that it was probably one of the most dynamic and demonstrated, to me, it demonstrated the true meaning of authentic engagement and meaningful partnership all across the boards, not just only with us parent leaders, but everyone, like Tiffany and Meryl said, everyone on the team. There was equity in the spaces, and we served the families that we were going to be interviewing. We also, that equity and the respect was also transcendent when in terms of how we worked with the parents that we interviewed. And so like Meryl said, there was 5 of us who were part of parent leaders that were part of that core team, and we weren't a monolith. I mean, we came with our own set of perspectives and the way in which we do the work, and we were very diverse. But I think it made the process even much more richer and much more fuller. We were at the very beginning, I think how we approach everything is like, what we don't know, but we learn as we go. And what we learned is like the process doesn't always have to be traditional, right? And so when we started this process, and it started off the traditional way of doing things. But we all kind of decided, like, in order for us to really be able to have success throughout this project, it needed to feel a whole lot differently. And so everyone on the team, I would say everyone on the team, although, some folks think it was kind of, some of what maybe a little bit challenging. I always think it's opportunity for us to learn, to grow in spaces, and just to really think outside the box in terms of how we want to approach doing the work. And so we weren't wedded to any of the traditional ways of doing things. We kind of like decided we're going to go a different route. And I think we operated on the same set of values. And I think that the high values in which we all shared and how we approached the work, how we felt about families, I think that was probably the secret sauce in kind of making this process as successful as it was. And, even when it came to working with, getting ready to work with the parents, we really had an intentional process of what that was going to look like. We weren't trying to exploit parents' experiences when it came to investigation. We knew it was traumatic. Many of us, most of us that were parent leaders, we have experienced investigations, so we know how traumatic that experience can be. But we wanted to make sure that there was a purpose to having them share that experience with us, and we wanted to honor that experience. And so what we did is we carefully planned how we were going to invite those parents into the space with us. And we asked them, we talked about, ways in which they can fill out the application process. We explained to them, in context, what this whole investigation, participatory action research project was going to be about. And we did Q&As. We had people come in, and we did, ways in which they could come in and talk and ask questions. I also, like Meryl said, I had created a video explaining the process every step of the way. And we also wanted them to have their own autonomy in the process. So we did tell them, you can share as much as you want. You don't have to answer any question if you didn't want to. You were going to take the lead, and we were just going to follow you in terms of what you wanted to share. And we wanted to honor them in that experience. I did about 15 interviews myself of different families from across the country. And it was so powerful to hear the stories from the parents. And it helped me, kind of like solidified some of the things that I had in my mind when it came to investigation. But also, it was just a way in which we can honor their stories. And so some of the things that we did try to do is, during the process, let them know that if there was any time that they wanted to stop, they could take a break. If they needed additional resources, we were able to provide that for them. After the interview, we asked if we could have an opportunity just to check in with them the next day, whether it was a phone call or a text message, just to say, hey, thank you for the time that we spent together. But is there anything else that you wanted to share with us? Or how did you feel about how you were treated in that interview? Or if there was, anything else that you wanted to share with us. And then we did that little personal touch every single interview. After every single interview, I took the time and just sat there and wrote a personal thank you card, just to let them know that I appreciated what they shared with me. I honored and valued their experience that they shared, and that, the fact that they, were still going forward in their lives meant something. And it was just such an honor. And I got so many different responses, like, wow, nobody has ever even asked me to share my story. bit more. So just saying thank you. And we also told them that, you know, it didn't stop with just their interview. We wanted to make sure, again, that what we were going to do is, you know, share this back with others so that we can really take a deeper dive into investigations and maybe seeing if there's a way in which we can transform that part of the front door in and of itself. And so, again, I felt like I was an equal partner of the team. I never felt like my voice was diminished in any way. I was on every single, I was the one that was on every single committee, subcommittee possible, because I wanted to learn, and I wanted to be in the space with all of my partners. What I know we have some of them here, but there was plenty more that would work with us, and it was just an amazing process. And I hate that it's kind of ending, but I'm also grateful that I get to be kind of on this road show to do this presentation, because I have an opportunity to still partner with some of the best colleagues that I have worked with. And with that being said, I want to turn it over to our colleague Jennifer, where she will give us share some of the findings that we had through this process.
Thank you so much, Dee. And the feeling is certainly mutual. I mean, I think the colleagues, everyone, including Dee especially, has just been amazing throughout this project. So what I'm going to do is give you an overview of what we heard, primarily from the parent interviews, but I'll also sprinkle some of the findings in from some of the other data sources as well. But I also just want to point out, you know, I'm a pretty traditional researcher, and this has been a very different process, and it's made me really sort of reflect on, I mean, I think we would never have gotten the level of depth of information that we heard if we had not, without engaging the parent advocates in the core team like we did. And not just engaging them as in, you know, here's my research idea, let me see what you have to think, but really, what do you think the research should look like, and how can we frame the questions in the best way possible to try to answer those set of questions that you have, and then bringing everybody back together to say, okay, what did we hear? What do we think the findings are telling us? So it's been just a really transformative experience for me. And I think it's allowed us to dig into a topic area that, frankly, for the amount of kind of the bad reputation I think investigations have, we don't have a lot of documentation of what families experience. So that's what we're going to talk about today. So if you look on to the next slide, I think the big takeaway here is that parents find this experience dehumanizing. And you can see with each slide, we've got a set of kind of key themes here under bullets, and then some of the quotes that we heard. There was very little or no due process that parents were aware of. The fact that agencies could remove their children was always hanging over what parents were experiencing, and always hanging over how they weighed what they could share and when they could share. They felt judged. They felt like there was an assumption of their guilt from the beginning. And then just generally, most of the parents felt like they were treated with just a very large amount of disrespect. So you can see kind of references in these quotes in blue, right? It's unfair, it's unjust. From a system where you're innocent until proven guilty. When it comes to family welfare cases, it's exactly the opposite. The quote in green talks about feeling like you're being interrogated. This is something we talked a lot about as a group, of what is the role of investigation? Is it meant to be like a criminal justice type approach where we're interrogating parents, or is it more about talking to families and figuring out strengths and challenges? But I think in many cases, what the parents were saying was they felt like somebody was coming in saying, you've done something wrong, you're likely not a good parent, and what I need to do is actually find the evidence to prove that. Next slide, please. Sorry, I'm like trying to change the slide myself. There was a distinct lack of empathy and transparency, and parents really felt like their perspectives were ignored. So it's interesting, we won't be able to dig into the caseworker and the judge findings, but one of the things we hear from them is that they think that investigations are an important touch point to check in with families and figure out what's happening more broadly with them, presumably to connect to services and such. But parents felt like nobody was really asking them what was happening in their family, what was going well, what kind of supports they needed. So you see here people saying they talked at me, not with me or to me, a probe for more information to make a case against me, and just nobody sitting down to try to figure out what happened. And even when I did actually get the chance to tell them what happened, it was ignored. It wasn't even documented. There really was a sense that investigative caseworkers were not trying to understand their family in any deep way. And in fact, when we survey the caseworkers, they often say they don't have the resources and time to actually do that. Many parents noted that the agency shared very little information so that families don't feel like they know what comes next, what's after this. Families where the children were actually placed out of home pretty quickly often didn't know where their children went. And then some folks talk about investigative caseworkers seeming to be going through a routine, like they've got a checklist they've got to get through in order to finish this. And this is happening at the time that is hugely traumatizing and emotional for parents, not surprisingly. On the next slide, we talk a little bit about the power dynamic that was sort of undergirding everything here, right? The sense that, so there's a general principle that parents are aware that their children can be removed from their care, but just feeling more generally like the caseworkers themselves had basically unchecked power. And there was some reflection even in some of the discussion about kind of, it really depends on what caseworker you get and how nerve-wracking that is when you're talking about something as important as whether your child remains in your care. They definitely felt like they didn't have any rights or opportunity for input. We asked them directly about, when it came to thinking about early case planning, how much were they involved, how much input did they have, and they just generally felt like they didn't get a lot of opportunity to actually influence. And the more they tried to advocate for themselves, the more they felt like they would be penalized for that. So you can see in green, I hate the system because I don't think the agency does much good. The people are kind of on a power surge and feel they have the right and liberty to remove your children. This quote in lavender just breaks my heart. So I remember there was one part of the case where the caseworker said, your daughter's in a bubble and one pinprick and the bubble pops and we can remove her from you. So there's an instance where the child was not removed right away, but that power was clearly lauded over them. In yellow, I never felt like I had a voice. I was flat out told this is what you will do or we will take them. So just this sense of, they don't really get a lot of say. They need to do what is told to them. Nobody asks them what they want, or they can lose their children. On the next slide, we talk about some of the services piece, and we'll dig into services in a little more detail than other things, given its connection to prevention. But really what we found was very few parents were given services to prevent removal. Few even remember being offered a case plan in this stage or in the immediate period after the investigation. Now, many said that they were, so distraught, they're not sure what they got and what they didn't get, but most said they did not get services. Those whose children were placed out of home were really frustrated that they weren't given services to prevent removal. And for those where services really were offered or were sort of mentioned, they didn't feel like they were connected to families' needs or interests. And in some cases, they were totally unavailable. So there was this sense, you can see it in the blue quote, right? They kind of did the cookie cutter thing saying, oh, you need to take parenting. So there was a lot of discussion about parenting classes and the sense that any issue that presented itself in this investigation process, the solution was to provide parenting services. You know, when we talk to the caseworkers, they talk about the lack of services and the fact that they create these case plans around what services are available, and it's possible that that's parenting services. But I think, you know, in green, you can see this is a family where they really were having issues with housing. And instead of helping them find housing, they remove the kids, they give parenting classes. There were cases where parents had to actually go track down the services themselves, or they got in and it was a wait list of, you know, a long period of time. So this question of if this system is meant to get families to support, is it doing that when the services aren't available? And I know that's something you all know an awful lot about. Now, not everyone's experience was the same. As you'll see in the next slide, it's a little bit busy, but basically there were 3 groups that really stood out. And then also there were a few parents, about 13 of the 100, who had some positive thing to say about the interactions. This does not mean that their experience was positive uniformly, but they at least expressed that there was some support coming from the caseworkers. And typically this was just the opposite of what we just presented, right? So talking about caseworkers who were empathetic, who seemed to listen to them, who said like, okay, I get it. And you're telling me that you didn't do anything. Let's prove that, right? And trying to help them and withholding judgment or getting them to services that they actually needed without putting them deeper into the system. But as I said, that was 13% of the parents. And even there, not all of them had uniformly positive things to say. Of sort of separate groups of parents who had particular themes, the fathers were very much reported facing gendered stereotypes, being judged as angry or aggressive if they showed frustration. There were fathers who talked about how the caseworker said, well, your job, you just need to go have a job. That's the only thing the father does. Some fathers that were were co-parenting or were still together with the mother would talk about the information going to the mother, the caseworker talking to the mother and not the father, or services that seemed inappropriate for fathers. Black parents, many of them reported bias in how caseworkers approach them and how the system responds to Black families more generally. Black women reported being treated as mentally unstable if they were advocating for their kids. So you can see here this quote, I was the only African-American person involved. The whole organization was all white. And so when I spoke to them or I would say anything at all, they'd write it down in notes that I'm aggressive and confrontational. You had some Black parents who would reflect on the fact that, they'd see on TV about a child who had been left at home, a white child who had been in contact with the child welfare system, was left at home and then, died or had some severe situation. And they'd say, well, if that had been a Black family, that child would have been removed. Parents who were facing issues with substance use reported that the caseworkers just rarely believed what they had to say. They were treated like junkies or like they were disgusting or like there was no chance that they were likely to get clean. There were several parents in the interviews who had gotten clean and said they were still treated like this even after they'd gotten clean. The orange bubble here is a broader issue of, admitting to needing services and care, in this case, because this person was struggling with addiction. And when that happened, she was immediately charged with neglect. We also had a parent who called a hotline to try to get services and wound up connected in and having an investigation. The next slide talks about how parents reflected on the impact of these experiences. The top note just says that, it could be hard in these conversations to distinguish what was the impact of the front end experience itself versus what came after. But some things were very much about that time period, right? So parents who reported being under extreme stress, both during and after the investigation. So their hair thinning, weight loss, depression, and inability to concentrate. Some parents who were using substances talked that they initially kind of went down a rabbit hole of using even more before they might have come back on the other side and gotten clean. A common theme that I heard that just stuck with me was sort of this fear of the sound of knocking on the door. This sense of like at any point in time, CPS could be coming back and could try to take their children. And so we heard both about parents fearing the sound of door knocking and children fearing the sound when there would be someone knocking on the door. And that just, I think that's such a salient example of the kind of trauma that causes. Parents noted effects on children's school readiness. That's my other area of work, on children's social relations. So lack of trust, especially in public systems. There were parents who talked about children who really don't trust the police, children whose parents went on to work with the child welfare system and were angry at their parents because they don't trust that system. Parents talked about older children using the threat of calling CPS against their parents. So caseworkers saying, if your mom does anything, you just give us a call. And then the older children, threatening to call even for something that might have been just a parent disciplining them or restricting access to something. But there were also parents who reported positive relationships with their children as a result of what happened, or children who showed really kind of extreme empathy. So there was one parent who talked about their child being extremely empathetic when they would see people who were homeless because of the situation they had been involved in, which related to housing. Other types of impacts included, relationships with kin, particularly if the kin was the reporter. That could lead to a lot of tension, or if kin were a major source of support for the family during the experience. There was a small number of parents who had employment disruptions. That was especially true if they worked at public agencies where they couldn't have this on their record. But also for some parents where the demands of doing what the agency was asking was getting in the way with them of their getting to work. And as I reported, so some parents with substance use challenges reported that this experience was sort of it was sort of hitting rock bottom, right? So initially they might have gone in and used even more, but it helped them really focus on getting themselves clean because like all parents, right, their children were the most important priority to them and they wanted to get them back. But even in those instances, those parents typically still talked about the fact that they should have been treated more humanely. So maybe this was appropriate, and maybe it even provided the circumstance to drive them to get services, though they often had to do that on their own, but there was no reason to treat them so inhumanely. We asked parents about what might make the system better. And there was really a sense of more parent voice and parent support in the system could be helpful. So mentors who can support and advocate families that are going through the process, parent advisory groups that can inform policy and process improvements, as well as some training on some of the topics that families really experience a lot of, related to trauma, parental engagement, cultural competence, mental health and substance use, really getting to where we can better understand and be a little more empathetic to what families are facing. The next slide talks about youth. We're not going to talk a ton about the youth findings. This was done by Think of Us using a very similar process. We heard a lot of similar things: lack of compassion, lack of emotional support, lack of transparency. Young people were frustrated about not getting resources to prevent removal, concerns about racial bias against based on sexual orientation or gender, and also just feeling that the entire process was disruptive, alienating, and traumatic for them. Young people also did not feel like their perspective was was incorporated. So presumably these are the people that the system is trying to protect, but they talked about not really being asked if they were comfortable going back to their parent or if they felt like some sort of services might help with their family. And they said it felt more like a process of surveillance than of support, which is something that parents' attorneys talked about a whole lot. In addition, youth reported sort of not knowing that the information, if they had shared information with an adult that led to the report, feeling a little bit like their trust was being violated because they didn't know that was happening, feeling like the whole focus of the investigation was really concerned with parents' compliance, not their well-being, and then really deep fears about separation from siblings. So very quickly, I'm going to talk about some of the findings from the parents' attorneys, the judges, and the caseworkers. So the attorneys were part of focus groups. The caseworkers and judges were parts of surveys. We were not able to, and nor did we kind of be as systematic in ensuring representation in these groups. So I would take them with a grain of salt. Just they're important findings, but in particular, the caseworkers, I worry we don't have enough urban and caseworkers of color. But having said that, let's look at what some of the perspectives were. For parents' attorneys, there was a real sense, we can move to the next slide, that the primary purpose of this system is actually should just be to investigate the allegation, that it should almost function more like a criminal justice system, in that there is an allegation or, kind of the equivalent of a crime that's being alleged, and that's where the focus should be. And this was something they came to over time in the focus groups after discussing kind of the use of these systems as a better way to identify supports for families. And it largely came down to the fact that they felt that if the system had broader leeway to really sort of look at families in a holistic way and think about what they've got in front of them and what they might need, it will function as an inequitable surveillance system, really for low income and parents of color. And so there was this sense that there really is not a way for the system to be anything more than sort of a very focused on the allegation and really only families where there's like evidence of physical or sexual abuse, basically. They did feel like parents need more representation during this investigation process. The parents' attorneys typically came in once the parents were headed to court, and they said they felt like the parents made decisions that they would not have advised, and that then affected their case when they went to court. They felt like they had too few rights. And they also talked about the number of required services that the agency tends to put on parents being a real barrier for parents, because as we talked about, there's a lack of services, but also you get this sort of laundry list that doesn't seem to be tailored, and it makes it hard for parents who are often working and trying to raise children at the same time to meet those meet those requirements and keep the agency happy. Caseworkers and judges both viewed this process more broadly, right? They thought it was a touch point to understand families' strengths and needs and connect them to services. Having said that, the caseworkers talked about really having an insufficient time and resources to do the investigation, and the judges had concerns about the competence of the caseworkers. But both groups actually felt like they get sufficient information for decision-making from this investigative process. So that's a little inconsistent. Humans are sort of, the way we work is we tend to believe things that justify our behavior. So, it could be that this is, they have to believe this, but they definitely felt like they were getting what they needed. Judges were worried both about competence and bias in the caseworkers. I think about 40% of judges agreed that caseworkers are likely to give more of the benefit of the doubt to white parents than to other parents. Mandatory reporting has multiple purposes. One is because it's people who see kids more frequently and might have access to information that others don't have. And then I think there's a degree of us thinking that mandatory reporters are more reliable, but we did not see that in either the caseworker or the judge's cases. They really did not have trust in the mandatory reporters. We also asked about other kinds of reporters, and the caseworkers had the least trust in information coming from parents. Neither group felt that investigations are overly intrusive, but judges really wanted to see more due process and legal representation, kind of like the parents' attorneys. The caseworkers did not feel like they needed more due process or legal representation. And we did see that caseworkers, like almost 90% of caseworkers said they see cases that should never have been investigated. But by the time it gets to the judges are saying they don't really see cases that shouldn't have reached them. So I think that tells us a lot about that, potentially about that funneling that goes on between reports and then what moves into a court case. And pretty much everybody says that the services are insufficient. Let's dig a little deeper on case planning. If you can move to the next slide, please. So as I said, pretty much all groups said that there was a lack of services, that they're sort of cookie cutter, not matched to what families' strengths and needs are. And some parents noting that they were referred to services that weren't available or given minimal information. You can see some of the data here on services. So only a quarter of caseworkers agree that services parents need are often available and accessible. Only a quarter of judges say families have been connected to services before they come to court. And nearly 60% of caseworkers say they structure case plans around the services that are available and accessible, which I think connects with the point of it not necessarily being matched to family strengths and needs. And in terms of improving the process, if we move on to the next slide, as I noted, parents really want more parent representation and a system that treats them more humanely with respect and transparency. There was no case of parents saying they have no right to be in my life ever, or this system shouldn't work. I think there was sort of an assumption that this system does exist and maybe should exist, but the sense was, why do you have to treat me that way? Which I think is really a different perspective on that, and a fair question, right? This is a traumatic experience for everyone. Don't make it more traumatic. I mentioned parent mentors and parent advisory groups, parents' attorneys wanting more legal representation for due process. And then parents and young people really talked about wanting more preventive services prior to removing prevention of foster care, prior from removing children from their parents' care. But again, the attorneys were nervous that if this was inside the child welfare system, it would be a surveillance system for basically low-income Black and brown families. So quick, just to summarize, parents and youth found investigation and early case planning humiliating, inhumane, lacking compassion and transparency, and reflecting bias. This sense that systems actors seem more concerned with blaming parents and enforcing compliance than providing support to keep the family together. Bias was a theme all over the place, from the parents, from the youth, from the parents' attorneys, and from the judges. And then just this point about a lack of services to prevent families' separation. And then finally, just this point that the vision of what this system is meant to do is not the same for different groups of people. So judges and caseworkers really feeling like the purpose of investigation was to be better understanding families, even though caseworkers are saying that they often don't have the time to do that. And then you have parents, attorneys who are like, keep it narrowly focused, otherwise it's gonna kind of go into areas that are sort of trampling on parents' rights. Caseworkers were the only group of everyone we talked to in which a majority felt that investigations worked well. It was slightly over half. But again, caseworkers and judges both felt that investigations provided information needed to make the decisions that they needed to make. So I think that is the last of our slides. It's a lot of information. Am I turning it back to Kaylee.
Yes. Sorry, just want to transition, let people have a minute with this content up on the slide for how to get more information or how to cite the project if interested. We do have some questions that have come in already. I'm going to share a quick response from CSSP before we get into the questions and discussion. So I want to just say thank you all for presenting this. And I think if you've been able to see the chat while you've been presenting, and I know some of you, Dee and Tiffany, have been in there responding, people have lots of questions and thoughts and reactions, and just want to thank you all for this powerful research, and especially the method that was used. That I think we know these things, we know parents have these experiences, but to have this systematic approach and really having parents interview parents makes it so powerful. So CSSP does a lot of work in this area, and our policy team wanted to make sure that we share a few thoughts about this important research. We really believe that CPS investigations, just the investigation itself, can be harmful to families and to entire communities when the threat of that investigation is looming over people, where we know in some communities a really high percentage of families experience this. So this is a critical view into the experience of families, which we hear in anecdotal ways, but putting it all in one place is really powerful. And of course, the racial disparities in how parents and caregivers are treated, and the youth experience of that, as well as the parents, makes it really, really critical that we change how this works. So the data really make it clear that we should try to be ensuring that families don't ever come into contact with CPS whenever possible, and that they're offered the supports and services they need outside of the formal child welfare system. Even the parents in this study who said that something positive came from it could have gotten that kind of support and service outside of the child welfare system without that traumatic experience for them and their children. We believe parents should be able to access help outside of child welfare oversight, and there should be investments in community resources and upstream systems to help parents meet their needs. Finally, just want to make sure that there should be ways when any of us are in contact with a family that we believe needs support. There should be a lot of ways to help that family get that additional support, not just a CPS hotline to call, and to find ways to get that support for families that aren't punitive, but really just work on addressing those needs and helping parents do the best they can with their kids. So we are really excited that this research was done, and really grateful to all of you for sharing it. And it's definitely going to be something that I think a lot of us turn back to again and again to cite for the importance of the kinds of changes and upstream work that we all think is so important. So with that, I want to turn to the Q&A. Folks have been in there typing responses to some of these questions, so I don't want to skip over something because we do have plenty of time for discussion. There were a couple questions about how families were chosen to participate and what geographic regions or states were represented. Several people in the chat saying, this sounds like my state. I think almost everywhere would say this sounds like what happens in my state. So just any comments about that regional and state and how folks were chosen to participate?
Yeah, I can take that. So we were really, especially for the parents, we were very, very strategic in the way we handled it. So what we did was we talked ahead of time about wanting to get as close to national representation as we could, and then also which groups we wanted to be sure to be able to speak to. So making sure that they were reasonably well represented. I'm trying to find my data on how many states we had. I think it was, I don't know if anybody remembers off the top of your head, maybe 20 something. But what we did was we divided, I used data from the federal government to say what percentage should come from each of 4 different regions. And then we worked with the parents to find parents who met both those regional and geographic criteria, but also various demographic characteristics to make sure that we had reasonable representation of Black families, of Latino families, of women and men, of people who had different levels of experience with the system. So it was really quite diverse, particularly for the parents. The number of states for the parents' attorneys was, I think, 12 out of 16 attorneys, so it was pretty broad. And then I think for the judges and caseworkers, the numbers were a little bit smaller. I don't know if anybody else wants to jump in from the team to talk about that.
I'll just add that I went back and counted real quick. Jennifer, it's 26 for the parent interviews, and I dropped it in the chat.
Thanks, Tiffany. Thank you both. And I saw a question in there as well about the compensation for parents. And so Teresa responded to that. Parents received $100 for participating in the interview, in addition to the in-conversation supports that Dee described. I have seen several questions about sharing the slides and the recording. Those will be posted. I've put the link in the chat a couple times. I will put it again. But those will be posted by early next week, both the recording and the slides, so you can share that with folks, or download the PDF of the slides for sharing it with other folks. Okay, we've got a couple of questions about the attorney side, and Jennifer, I know you were typing a response to Martha's questions. Martha had a question about whether you heard from parents about a need for representation for parents to get attorneys, or if you heard that just from the attorney's side.
So we did not hear parents talk about, there might have been one or two, but for the most part, we did not hear parents talk about wishing they had an attorney during this stage. But, it definitely came up with the attorneys, and then we directly asked it in the surveys of the judges and caseworkers. And you'll recall the judges felt that they should, but the caseworkers did not. So for pre-petition, yeah.
Okay, thank you. And I think there's a couple questions here to dig in more on the distrust of mandated reporters. Sounded like that came from caseworkers and judges. Can you say more about how that was expressed or what they meant by that?
So those were survey items. The real downside, right? You can see we've got like this huge, rich set of information from parents and from the young people. Those were interviews. We did surveys with the caseworkers and the judges. So there's a lot of not sure what that means underneath it. What we asked them was, to what degree do you trust, I'm trying to remember the exact language. It was something along the lines of, to what degree do you trust information coming from different sources? And so the mandated reporters were in there, and then a few others, and you can see there just was not a lot of evidence that they have much larger trust. We don't know what's behind that. We do have, let me see if I can pull up the data. It wasn't uniform. It sort of depended on the reporter. There was a lot of trust of police for the caseworkers in particular, but less of educators. And then, parents were at the bottom for the caseworkers for sure.
Okay, thank you. We also see a lot of questions about what these findings are going to mean. And I know this is pretty fresh. It hasn't been put out in a publication yet, and that is yet to come. But I think there are several questions about the Children's Bureau learning from this, incorporating some of these learnings into the CFSR measures, or just what jurisdictions might do differently. So I'm wondering if anyone, and this could be just your aspirational thinking about how systems should change as a result of these findings, or anything concrete that you can share that you think will actually happen.
I think I'll try to take that one. So this project, I didn't share earlier that this project has multiple phases. So the first part is really to explore the perspectives and the experiences, but the hope is to replicate this project in local areas, including the participatory approach, to get information about how to make change in a local area and to hopefully support change there. We don't necessarily have a plan to work with the Children's Bureau or necessarily like a clear policy agenda. What's important is that we at least get this information out now, and we're still in plans of figuring out what to do with this information and how to move forward. So I know that's like a non-answer, but just to say we have not yet, but that doesn't, we're not sure what the next steps are related to the national policy agenda.
Anyone else want to add? You can separate yourself from the formal findings and say what you hope might happen.
I would share, this is Meryl, just in terms of some of the findings around parent advisory councils and parent partner and parent mentoring programs, because that's been one of the hardest areas to cover in terms of getting funds to fund evaluation of those kinds of programs. And so I think this kind of a study is also another way to validate how helpful that is, as parents have to navigate all of the services and the systems that they go through. I don't know, Dee, if you might want to add to that as well, in terms of some of the experiences you've seen.
Yeah, I'm hoping that the front door gets smaller and smaller and smaller, and that we really look in our communities for the resources and support for families. But even if that front door is small and narrow in scope, the hope is that still we treat people with the utmost dignity and respect, no matter how, no matter how they come into the child welfare system, into child protection. What I heard time and time again was just the abject cruelty of it all. You don't have to be that cruel just because you can. And so if anything, I'm hoping, and I'm sure most of us on this call is hoping, that there's something that can be done with regards to just how inhumane and dehumanizing that process really is, and that there should be some accountability for that. There should be some reciprocity for that, some reconciliation for that, some healing. People, like someone said, even if you experience the investigation itself and nothing came about it, there was still trauma that was left. And there should be another way of doing that. So if any way we can treat people with dignity and respect, no matter, the person and why they're in front of you, I think that to me would be a powerful way of honoring what families have experienced across the country.
I'll just add too, with the work that's being done all over the country by family resource centers, home visitors, all kinds of prevention programs and strategies in communities. I don't know that we needed to be reminded of how important this work is, but I think it makes that message more clear to those who might not think about prevention as often as many of us do. And I think the fact that services, many folks, I think, see a referral to child welfare or a report as a way for family to get services. And what's really clear is that that's not necessarily the case. Adding trauma and still the services in the community are still the services in the community. And I don't think child welfare workers are always well versed in what's available in the community to even make referrals or share information. So I'm hoping those of us working in prevention can also use this to approach our child welfare systems in the communities and the policymakers and the leaders in the state and talk about how can we fill those gaps. You know, families are living their lives. They don't know whether they need a particular prevention program or even that something might be available sometimes. So how can we make sure to normalize family resource centers, mutual support groups, home visiting, the menu of items that will help families? And that is one of our long-term hopes for this. I know that might be a ways off, but community by community, we might be able to see some changes.
Thank you. Did anyone else want to jump in there? I think there's a related question that someone posted in the chat just about what are the options? What kind of prevention services are actually needed? It'd be really interesting to hear anything the parents in this study shared about what they think could have helped them outside of the system, instead of the system, or even a referral through the system, but what did they actually need? If it's not directly from the parent interviews, we can just talk generally. I think a lot of us have opinions about that and knowledge about what is available in communities. So who would like to jump in?
So I took a stab at answering that question. We didn't specifically say what services would you have liked to have, but we did ask what could have been done differently. I think for really what we heard was something that was more tailored to my situation. And then there were several parents who talked about housing. That's the one that comes to mind as, where it was raised specifically of if you could have gotten us housing, we would have been, that would have helped, right? There were just a lot of families where they were in this situation because of housing instability. I don't know if others who participated on the interviews want to weigh in on what you heard.
I think, I tried to ask this question in multiple ways. And I think folks had a difficult time. It was challenging for them to reflect on something that is outside of this current structure, right? So thinking about what would the possibilities if this wasn't even a child welfare system constructed like it currently is. And it was really hard for people to think about what that possibly could look like. And so, it came back to, just, treating them with respect, but also paying attention to and listening to them about what they say they needed, and then operating from that lens, something, along the lines of that. But again, just not really having the ability to see beyond what could be possible for something that would be different, that would look totally different than what the current system actually looks like.
Thanks, Dee. Anyone else want to jump in on that meaty topic? I see some comments in the chat. I think it was Ken typed universal daycare. Gail just wrote in, they need what all parents need, a decent place to live, help cleaning that place, help watching the kids, a break, reliable transportation, income opportunities. Indeed.
And I think those opportunities and those resources and supports really need to be targeted based on the individual community. It's not cookie cutter. Not all communities are a monolith. They don't look the same. They don't. They have different needs. Some similar, but I think it needs to have a very targeted approach, and it also should encompass all of community. So we're not talking about just the formal, traditional supports, but we're talking about the non-traditional supports. We're talking about members of the community. We're talking about retirees. We're talking about all of I call them the goodies in the communities that we don't really tap into. Everybody has a role to play in really supporting families in their particular community.
And I'll just add an undercurrent to all of this is listening to the parents, listening to the young people about what they need. And it's kind of mirrored in how we design the process. We took time to listen to what would make the process the most authentic. And I think it's the same. I think the parents would say the same. Listen to what we actually need so that it's tailored to what I need instead of just saying a parenting class or just filling in the case plan. So I just wanted to add that piece.
Yeah, thank you. And I was just going to say it was really striking, the one quote shared about housing where, you know, you're told you have insufficient or unsafe housing, so we're moving your kids and you have to take a parenting class. Like, I'm all for parenting education. I think it's a wonderful thing that we can all benefit from, but that's not what's actually at issue in that situation. You know.
Yeah, and I just want to share this, even as a personal, a little personal note with you all. When I was being investigated, it was truly a mental health situation for my son. And what they told me is what they offered was parenting classes. And I was like, that's not what I need. And I could teach that parenting class. So I found it very insulting when, you know, I needed mental health supports, behavioral health supports for my son in our community. So that cookie cutter parenting approach, they need to throw that whole thing out.
Right. And to think about a child who's struggling with mental health is probably not going to get better by being removed from their existing supports and family. So really need things to be tailored to the actual situation and not just check off a box. I think we've answered the big questions that have been raised. There's so many good resources being shared in the chat. And I know I've missed some things, but I think I caught the questions. If you had a question that we didn't get to, please type it back in or raise your hand and we can unmute you. But I think we might be done getting through those. Just want to thank you all so much. This is really powerful and I'm really grateful you've done it and excited to see how it can help to shift things in so many needed ways. So thank you very much. I think I'm going to hand back over to Maureen to share some updates from the Alliance, and then I'll come back with the updates from CSSP.
Thank you. I just have one quick update, but I will say that, you know, as we're thinking about all of the resources that families and parents need, it makes me think that, you know, we also need to think about resources and supports that help parents be successful and thrive and not just survive all of the time, right? So it's just, the work was incredible, and thank you all for sharing and for asking these important questions. The Alliance has a training of trainers around the protective factors framework. And our next open training is May 8th through the 11th. So if you are interested in becoming an Alliance certified trainer, you can find the registration information here. You can also find it on our website. And my friend Lucretia Rose is putting in information on the flyer and how to register. We have over 1,800 Alliance certified trainers now across the country. So if you want to join that network, let us know. And thank you, Kaylin.
Great, thank you. I'm going to share a few updates from CSSP. I'm going to put all the links in the chat at once and just, you know, spoiler alert, it's all right there because it's easier to put it all in at once and then talk. So at CSSP, we're very excited to welcome our new president in a few weeks. Leonard Burton will be stepping into the role of president. Leonard has been at CSSP as a senior fellow for, I think, 8 years, and we are all very excited for him to take over leadership of the organization as we transition from the excellent, wonderful leadership we have had up until now. So Frank Farrow had retired in 2019, and Judy Meltzer is retiring this year. And so we're very excited that Leonard will be stepping into that role, and I'm sure you'll be hearing more from him. There is a link to a blog post in that batch of links that I dropped if you'd like to read more about Leonard's background and how he's coming into this role. Also, last month's webinar, we shared this, but in case you missed that, I wanted to make sure folks saw that we did launch a new website called Nurture Connection, which is the home for the movement for early relational health, closely related to our Strengthening Families work. It's a movement to promote positive, strong, and nurturing early relationships and to build a healthier, resilient, and more connected world. If you haven't seen it yet, check it out just for the adorable pictures like the one on screen right now. It is a beautiful website with wonderful photos of infants and toddlers and the adults who love them, and lots of great content there as well. Also wanted to highlight a resource that came out last month, I believe, Rescue and Childcare, the American Rescue Plan Act's Positive Impact for Families. This study that's published, that's reported on here, will also be part of our webinar next month when folks from our policy team will be talking about what the American Rescue Plan Act has meant for childcare and what's going to happen in states now as that money goes away. Not immediately, don't worry, but as states are planning their next budgets, what that's going to look like. So you could look at the report now. You can register for that webinar, which will be on April 13th. A lot of our partners have events coming up. Most immediately, HOPE, the HOPE National Resource Center. HOPE stands for Healthy Outcomes of Positive Experiences. And again, closely related to Strengthening Families work. There will be a summit at the end of this month. So you can scan that QR code or click on the link in the chat to register and join us for that summit, which we're looking forward to. Some of our other partners also have conferences coming up. So there's a virtual National Conference on Child Abuse and Neglect, or NCAN, that will be spread out over 6 days in April with virtual sessions that you can join. The BUILD conference will be in person again in Anaheim this summer in July. And Prevent Child Abuse America is holding an in-person conference again in August in Baltimore. Just a note, the Prevent Child Abuse America conference is still accepting proposals for sessions. Those are due by the end of this month. I believe they just extended it to March 31st. So lots of opportunities to get back to in-person conferences or join virtually and engage with your colleagues again. And those are all going to be great. So with that, we are done with our content for today. Just want to thank everyone for joining us, and especially those of you who stuck with us to the end. And many, many thanks to Teresa, Meryl, Jennifer, Dee, Tiffany, Maureen, Lucretia, everyone on the team. Thank you all so much. And thanks for the presentation and the great work that you've been doing. And thanks to our wonderful participants who had so much to share in the chat and questions. Everybody go on and have a great day. And we will see you all again soon. Thank you.
Thank you.